Hello, welcome to this series of videos related to curriculum development in health professional education. The aim of this series is to support postgraduate health professional education students at master and PhD level, as well as faculty members involved in curriculum development, curriculum committees, and delivery of the curriculum. My name is Mohamed Hassan Taha. I am medical educationist with the passion to enhance population health through health profession education. Let us start with the first video. Today's video will be about overview of the curriculum approach, and educational philosophy in health profession education. Let us start by defining the curriculum. What do you mean by the curriculum? Curriculum, from linguistical approach or origin, is mean a race or a course or a career or a pathway of a specific course of study or collective all courses of study in university, college, or school. The most important message here, curriculum is not a course syllabi. It's a collective learning experience. If we can see here in the screen, you will find different perspectives and views of the curriculum. And the common things here, all these perspectives describe the curriculum with the holistic approach. For example, in early definitions of the curriculum has been defined by Bobbitt as things which learner must do and experience to develop the abilities to do things well and to make up the fares of adult life. And the concept has evolved over the time. And Cairn, Thomas, and Hook in 2009, they describe curriculum in health professional education is a bland breadth of educational experience from one or more sessions on a specific or a special subject to year-long course from a clinical rotation or clerkship to the entire training program. So the message here, and you can take a screenshot of this screen to see the different definitions of the curriculum. The main message here, curriculum is not a course. It's not a course syllabi. It's not a collection of course syllabi. It is the entire learning experience that takes place within the health professional education school. So the concept, it was equated in the past with the syllabus and the timetables of the educational program. And the curriculum document include statement about the content, subject to be covered, and the courses that the students should attend. But the concept has been evolved and widened to include not only what is available in the document, to include the learning outcomes, teaching and learning methods, educational strategies, the context for learning environment, and the assessment procedure. So curriculum is a wide spectrum of all this. And the concept of authentic curriculum has been also evolved because health professional education is unique in comparison to other science. Because the aim here is to improve the central goal of health professional education is to improve the population health. From this central goal, the concept of authentic curriculum emerged. And this concept basically from university to real world. And authentic curriculum has its aim that the learners will have the ability to perform in their workplace, whether the hospital, community setting, healthcare system, as an outcome of the educational program. Medical school and health science schools have been criticized for a long time, are being pressed to ensure that doctors and healthcare professionals trained are able to meet the societal health need and the community. So in line of this concept, the authentic curriculum, the move has been shifted to outcome-based approach with more emphasis on the professionalism, empathy, self-regulation, and cultural sensitivity. And education strategies also has been evolved to consider integration and integration of between basic science, clinical science, as well as the behavioral science. Also, the concept of the team-based learning, problem-based learning, and the teamwork reflected in introducing interprofessional education, task-based learning, and so on. Considering the social obligation with the community, also the concept of social accountability has evolved. So, in a nutshell here, the authentic curriculum refers to moving from the university to the real world. And we have different type of the curriculum at the same time. Hamdi 2002 introduced the concept of concurrent curriculum. We have different levels of the curriculum, starting with this level, the intended curriculum. We have curriculum in action. We have learned curriculum. We have hidden curriculum. And this is the use curriculum. So we have curriculum, something in paper. In reality, we may have something different from the something that we have in paper. And students learn things that are not well written or documented in the paper, or it's not as part of the intention of the medical teacher. So this is the exact description of the curriculum. And we can see this clear here. So let us zoom in into the different type of the curriculum, starting with the planned curriculum. Planned curriculum is the curriculum that is available and written and documented in the documents, in the curriculum document, and agreed by the curriculum planner, the teachers, with aspiration, with the intention, with the outcomes documented. But the actual or delivered curriculum, which is the reality of the students or trainee experience and what has happened. And the learned curriculum, which represents the students' knowledge, skills, and attitude as a result from the overall learning curriculum or learning experience. And you can see here. And the students also learn from the hidden curriculum, and we will describe the hidden curriculum in a separate video as part of this educational videos series. So, thinking about the curriculum is not thing that happen within the medical school or health science school, because educational system is a complex system, and it is open system, not closed system. So there are many external and internal factors that can affect or shape the educational program and educational curriculum. So let us together explore these factors. Looking at the curriculum from theories of learning, many teaching and learning approach has developed. For example, constructivism learning theory, behaviorism, cognitivism, and so on. So problem-based learning, self-directed learning evolved. There are some theories related to professional practice. So for this reason, teamwork, interprofessional education, ethics, integrated curriculum also evolved. With social values, considering the social obligation to the community, so the concept also of social accountability evolved. The regulatory bodies, they have their concern about the knowledge and skills. So for this reason, you'll find a group of educators focus on doing research on skill lab simulation and so on. Professional, also such as the communication skills, training, and professionalism, this is also dimension of the curriculum. Medical education is characterized by expansion in the knowledge. So for this reason, people start thinking about the core curriculum and elective courses within the curriculum. There is a development and evolvement in the health service. So for this reason, a perspective of community-oriented curricular and multi-professional elements also emerge. There is also important political factors for, like in COVID-19, some countries, they decided to reduce the number of the years for studying some healthcare professionals to have a rapid cohort of the graduates and to fasten the graduates to support the needs of the health system so that you'll have shorter curriculum and foster the production of health care. Accountability and transparency. So we'll find like outcome-based curriculum and objective-based curriculum. So all these issues together shape the current or shape the current practice in health professional education. And moving forward to the approach of the development of the curriculum, there are several approaches: 4-step approach, 5-step, 6-step approach, also 10 questions to be asked while designing the curriculum, and so on. But as you will see here from this screen, they are and the subsequent screens in this presentation, they are close. The 4-step approach start with defining the outcome and the aim of the curriculum. Following the definition of the aim and outcome, then move to the content, what to be delivered. Then the organization of the teaching and learning and how the course is organized, and finally the assessment. The first question here: what educational purpose should the school seek to attend? What educational experience can be provided that are likely to attain this purpose? How can this educational experience be effectively organized? Score, options, modular. We'll describe this in detail in the subsequent videos. And how can we determine whether these purposes have been attained? And this is by the assessment of the curriculum. So this is a 4-step approach. We have another step approach, 5-step approach. It includes the same 4 steps, but it starts with the situational analysis so that to develop a contextual learning experience in the curriculum. So the 5-step approach starts with the situational analysis, doing need assessment. What educational purposes should the school attain? And this is related to the aim and objective. What educational experience can be provided that are likely to attain this purpose? This is related to the content. And how can this educational experience be effectively organized? This is related to the organization of the curriculum, teaching and learning methods, and how we can determine whether these purposes have been attained, and this is related to the assessment. We have also 6-step approach developed by CARE, and this 6-step approach starts by problem identifications and need assessment related to healthcare problems, current approach and the ideal approach. Move forward to the targeted need assessment related to the learning environment. Then goal and objective. The goal, the aim of the curriculum. Then zooming into the educational strategies, the content and methods. Then the implementations of the curriculum and what support that we need. And then for the evaluation and the feedback. And as you can see here, all these steps are closely interconnected and work together. So we have 4-step approach, we have 5-step approach, and we have 6-step approach, but most of them there are many similarities. And for the medical education and health professional education, a lot of development and advancement took place over the time. And the current history or the current practice of health professional education has been shaped by the Flexnerian report in US in 1910, where the Flexnerian area that fostering teaching center approach, knowledge giving, discipline led, hospital orientation, having standard programs, and based on the apprenticeships, and therefore that has been done by Flexner lead to change in the current shape of the medical education from only apprenticeship to the basic science, clinical science, research, hospital training, structures, and so on. Over the time, the work of Harden and educators, they developed a SPICE approach. And SPICY for student-centered, problem-based, integrated curriculum, community-oriented, having elective course, plus the existing course and the systemic approach of the development. And over the time, it has been evolved to a SPICY continuum. And each medical and health science school should define at which part of this spectrum. At the left side here is a SPICY, and the right side, the classical or the old approach. And it's very important to do this mapping and to decide at which level of this SPICY is needed. We cannot criticize the right side at all. We need some sort of having lecture, having apprenticeship models, and so on. However, we need to focus on the student-centered approach and the authentic learning approach. In a summary of this video, the curriculum, the classical way of the curriculum or the traditional model, we have the curriculum, we have the educational objective, and then the assessment. While the new approach for the competency-based curriculum derived from the outcome-based curriculum, we have this health system needs and community needs, and from this health system needs, we develop the competencies, and then we develop the curriculum, and we plan assessment of this competency. This is just as introductory video to the curriculum concept and philosophy. The rest of the videos will zoom in and describe in details these concepts. Looking forward to seeing you in the next video of this series.